Dose podcast. Today we have the person that is responsible for making us look as good as we do. The most beautiful, most wonderful Dr. P.
Thank you, ladies. It's so exciting to be on Double Dose. It's something I've really been looking forward to.
Oh, we are so excited to have you here. I think every woman wants to be beautiful, and we're so excited to get an expert to help us through this journey. So today we're talking all of the things that people are scared to talk about, things that people generally try to do quietly under the covers, and we are uncovering all of it. So you're going to find out what makes us most beautiful, what can make you most beautiful, and the things that Parushinee and Dr. P actually recommends. Firstly, Dr. P, I want to say thank you for being so visible on social media. I think when choosing a doctor for aesthetics, it's so lovely to have somebody that's educating the public. And it was something that really helped us on our journey. And when we chose a doctor to help us through our skincare routine. So I think that's amazing.
I love that. I love that about using a platform to educate about doing safe aesthetic practices. And even if one of my followers, for example, never ever walks through our doors, at least they would get some education about how to look after their skins in a safe way, and get some education on the small things we can do on a day-to-day basis to help us look and feel our best.
Absolutely. And there's so many times that you Google things, right? But you're getting now an expert that is actually, without even thinking that information, is giving that information out, like about vitamin C, tretinoin, which of your skincare treatments. I love your posts, and they do really well, right? So as a doctor, to be visible on social media, do you get any kind of backlash for that?
All the time. I think I think it's always in the medical profession, and I think you guys can also relate to that. There's a perception that that you need to behave in a certain way, and I find that I'm searching to find a way to balance being a professional but also be relatable.
Absolutely.
And I think that when you can come across authentically as truly caring about educating your audience, I think then you are true to your profession. You are true to what you stand for. And I think I with the good that comes from social media and the way it's helped me both as a professional and a business owner, you've got to learn to take the good with the bad.
Absolutely. Totally. And the most important thing is that you're showing real patience. So you're showing real results. And I think that is lovely for people to see exactly this is what you started with and this is the improvement. And that shows us that we are trusting your process and more likely to go with you, right?
Yeah, definitely. Totally. Yeah, and I think people, it's great also to have amazing, before and after pictures. But I think people also want to know the stories behind it. They want to hear what real people are saying about their journeys and what they've been through. And I think I've also been quite vocal about my own journey.
Yes.
I'm quite happy
I love
to put that out there. And,
and your skin has never been looking better. It's stunning.
Thank you so much.
You have improved. I've been following you for years.
And I feel that the hard work, because it is a journey.
It is a journey.
Yeah. I love what social media has allowed me to do, and I do feel like I do strive to keep it professional, ethical, and education first.
I love that content creation is also a career, right? So you have to have some funny moments, which I love, your funny TikToks, because that keeps your viewer engaged. Because if you're going to come and be serious and only give medical facts, you're going to have a very small audience.
No, 100%, but it also makes it fun for me.
Yeah,
it makes me, enjoy what we do, and I think just as the practice as a whole, putting together the funny videos, it makes that creates that energy, creates that vibe, and you're 100% right. If you're only doing sort of factual tutorial types of content, you lose the engagement, and sometimes we learn more when we're having a laugh.
Absolutely. So let's get into it. Firstly, a lot of your clients, because we're derma based, is going to be brown skin, right? What is your first advice you give to somebody in their 20s, 30s, 40s, and then 50s and over with regard to skincare?
Okay, so I think that as we evolving through the decades, so must our skincare. Our concerns are very different when we're in our 20s, and we have great collagen and our baby bottom skin, and then when we get into our 40s and we're seeing a little bit of the aging, there's different things, different goals and different things we're looking for. But I think the basics remain the same. Sunscreen,
Absolutely.
100%. And I would say take the time and energy to find the one that suits you, because as much as I can say this is the best sunscreen out there, the best one is actually the one that you are comfortable using every day. You know?
Absolutely. Yeah, because there's some that burn your eyes, there's some that you don't like the white cast. So there's a lot of things that depend on you. So some make your skin too oily.
Completely. And so if you, even if I said this sunscreen is amazing, if you don't enjoy using it every day, you're not going to use it.
Yes.
And then the other two things I would say like that forms a basis is like a good moisturizer and hydration, more than creating like occlusive barriers on the skin. And I say hydration because even oily skins need hydration.
Yes.
You know? So holding water into the skin will help your skin age better. It will help you, you know, even with your acne, you know. And then the third thing would be a nice cleanser, you know. So obviously for every skin type, you would be looking at different options, but I think that's a good place to start with the basis. In our 20s, I think we must also just enjoy where we are. You know, if you don't have problematic skin, keep the routine simple, you know, don't get too caught up in the TikTok videos of having to use this and that. And, you know, I would say start maybe with a nice vitamin C, because vitamin C is antioxidant, it's brightening, it's actually help reversing the damage of UV lights, which is what causes us to age, you know. So that's probably what I would say if you have fairly good skin and what should I do in my 20s. The basic three, and then start adding a vitamin C. I think in our 30s we kind of start seeing a little bit more of the signs of aging, and definitely with brown skins we tend to see a lot more pigmentation or sunspots and a little bit sometimes melasma peeking through. So then you kind of want to take it up a notch, and one of the ways to do it is definitely looking at a retinol, and you know that's a whole discussion and family of family of ingredients on its own, but those are the things you can start, you know, seeking advice on and looking at. In our 30s, I also think, you know, you can then open the questions to a few of the aesthetic treatments, you know. So do you want to consider doing a bit of toxin that can have a preventative effect long terms in terms of lines and wrinkles? You want to consider doing things like skin boosters that keep your hydration, all sort of minimally invasive, but is helping you in the long run. I think when you get to your 40s, we're definitely doing as much of maintenance but damage control as well. The skincare routines do get a little bit more advanced. You start introducing eye creams and you know, other ingredients into your product line that will help you with your specific concerns regarding how you age. And we all age differently, you know. Some people only age with pigmentation, some people have massive volume loss, some people just have fine lines and wrinkles. So I think that at each phase you're going through, seeking some sort of professional advice to is, okay, what is my journey forward? It doesn't always mean that you have to see someone indefinitely, but it's nice to know what your skin needs and what you need. So, I mean, my take-home message from that, like, you know, aging through the decades would be get the basics right, and then maybe at each point, you know, seek some professional help in terms of what you should be doing in terms of your journey.
Oh, I love that, yes. So, two things from what you've said. Firstly, do we not do retinol in our 20s?
So, I think that, you know, because the retinoid family is so massive, you know, and there's different things that you can do with retinol in your 20s. For example, if you are acne prone or you have acne scarring, there's a place for your retinol then. So I said it's definitely dependent on what your skin concerns are. If you have beautiful skin in your 20s, I mean, you can actually get away with not using a retinoid at that stage. If you are struggling with like post-teenage acne and you want to start lightening your scarring, you can start looking either at getting like an over-the-counter retinol in your, you know, cosmetic brands, or you can even look at going for like tretinoin in a prescription. But you don't have to use it every night. You can have a low maintenance routine of maybe just 2 nights a week, supporting it with a good quality moisturizer. So as much as I can give advice on, like, you know, generally, the specifics is what gives you the best outcome, you know.
So I must say, you prescribe Aclif for Thachet. It's been working magically. It's the first time I see that his acne is more controlled, but also his skin is also getting lighter at the same time. The hyperpigmentation from the scars.
So like that's a 4th generation sort of retinol tretinoin, okay, and that's a fairly new product in the market locally, and it's more specific for acne scarring, oily skins. Okay, right. And like so there are many tretinoins out there, and like prescription ones, but they each have a different kind of sort of receptors, and that so they work differently. The one that we are talking about now is actually most specific for acne and acne concerns.
I'm so impressed with it because we did try different before and it was disaster. It was his skin was too sensitive. He literally flared up with eczema. So I'm happy with this at the moment.
Yeah, it's nice to find that he's actually found it works.
So what I want to ask is, TikTok really does give you a whole, literally, counter of ingredients. And people have now got a 10-step, 20-step night routine, right? So when people say azelaic acid is the one you need to get, then you need to get tretinoin, then you need to get hyaluronic acid, then you need to get, and people in an attempt to get the best skin ever are literally using 10 products at a time.
So I'm saying, I think I need to retire soon because by the time I finish my morning routine, it'll be time to start my evening routine.
But is it effective to use that many actives at the same time? Are we wasting our money? What is the absorption rate? What is also the time that we need to take between applying each product?
Okay, so I have to say, people that are doing 10-step routines, they have a lot of time.
Okay?
Yeah, exactly. I have the luxury of having literally anything.
Access to
product at my disposal, and I keep it super simple. For me, I think if you can do something simply, regularly, every day, consistently, you'll see far more in your skin in terms of outcomes and results than you would do by using 2 weeks of a 10-step routine.
Because that's also not sustainable, right?
That's the reality, and it's something I say to my patients over and over again that I like to keep it simple. And when it comes to like building on your ingredients, medical skincare has become so smart. The more sort of advanced formulas now tend to combine things. So like opposed to having like a serum with hyaluronic acid and vitamin C, they actually have formulas that combine it. Your moisturizer has hyaluronic acid in. So I think that if you want to really get the most out of your skin, try and keep it simple. Look for formulations that do have combinations, so that you're not doing 10 steps in the morning.
Yeah, and I think very often also people get mistaken by the cheaper brands, but you are buying 3-4 products, 100%. And if you had to combine the cost of those 4 products, you'll find one that's slightly more expensive, but it's got all of it in one product. Definitely. So it's easier to use and cheaper in the long run, right?
Completely. And also, like, when a formula has multiple ingredients in it, you know that those ingredients are meant to actually work together.
Yes.
As opposed to you kind of, choosing this and choosing that and choosing this. I mean, you're not sure, for example, how to layer it, what comes first, what comes second. If the two of them are actually going to be compatible, if the one product makes the other one, increases the absorption, and if it's inactive, then it means that you're going to react to that, So I feel that keeping the routine simple is important. And yes, there is so many amazing ingredients out there, but you actually can't use every single one of them.
Totally
You need to decide in this phase of my life for the next sort of 3 or 4 months, this is what my goals are. So I'm going to focus on that, And there's also some really great sort of skin application techniques, like the sandwiching techniques, also the skin cycling, which is a great way for a more advanced skin to keep all the ingredients kind of in your skin routine, but not doing so many things at a time. And when it comes to the TikTok thing, it's so hard.
It's so hard. Honestly, people swear by the results. Also, there is this concept of paid partnership, right? So it's also hard to like figure out what is real and what is not in those amazing results, number one. But I think I agree with you. Keeping it simple is something that is going to be sustainable.
Yeah, and I think that you educate yourself, and the education is available more than just on TikTok.
Of course,
also, and sometimes, as I say, getting that professional advice doesn't always mean you're going to have to commit to buying all the products, doing all the treatments. It might just give you some direction in terms of what your skin actually needs. I cannot tell you how many times I see someone who has the most amazing array of products in their cupboard, best brands, best ingredients, but because there's just so much available for them to use, there is no rhyme or rhythm to it, and they come with damaged barriers, the pigmentation looking worse, breaking out, having dermatitis and reactions to it. So Yes, like everything in life, simplicity
Absolutely,
is
and I
always a
think
win.
also genetics play a big part, right? I mean,
100%.
Korean skincare is the trend, but I think Koreans often are born with beautiful skin. So, so I just think that we also need to look at how are different types of skin age.
100%. And I also, I think I'm famous in the practice for saying this among the girls. Korean skincare is amazing for Koreans.
That's
Absolutely.
what I would think. Yes.
And I think fundamentally you're right. They actually have a drier skin than we have.
Yes.
So a lot of their formulations can actually be a little more richer and
hydrating,
nourishing,
yeah.
in terms of the base formula. The other thing is that they live in a completely different climate,
Yes.
and I am yet to find a Korean skincare brand that has done their testing and their trials on an Indian skin living in South Africa,
Of
or a
course.
brown skin living in
Absolutely.
sub-Saharan Africa.
Absolutely.
So I think those things are also important.
Yes.
Is as much as there's no dispute in terms of the quality of the formulations, or
It's amazing.
the
Yes.
ingredients and the science behind it, but is that
What
suitable
we
for your
need.
skin?
In
That's
South
the
Africa
big
and our
thing.
South
Yeah.
African sun.
Yeah.
Absolutely. I think that is where we get mistaken, and that again comes back to education.
100%.
So I think our takeaway from this is that for skincare, we're going to keep it simple and we're going to be consistent. And you guaranteed results with that. But also get that consult with the doctor so you know where you're going and you know what you're doing.
And I think let's target certain skin concerns at a time. We can't want to do everything at the same time because it's going to complicate it. If hyperpigmentation is what's really bothering you the most, let's focus on that. And when you're happy with the results, we move on.
Completely. And I know sometimes, when you make the list, when we look in the mirror in the morning,
Yes.
with all the things you want to change about yourself, that list can be pretty long, But I think maybe prioritizing one or two things,
Yes.
addressing that. And if you've gotten improvements with that, you almost feel like, you're feeling so comfortable with the skin. You don't have to chase every line, every
Yes.
wrinkle,
Yes.
I think that also being comfortable with where your journey is going is so important. We can all be so critical about ourselves, about what we're seeing in the mirror, about what we're seeing with other people, what we're seeing in social media. But I think actually finding out what is truly bothering you, and not based on comparison, based on what
Absolutely.
you are
Yes,
feeling and
yes.
where you actually want to go with your aging journey, with your skin journey.
So we spoke about skincare, and there's only so much skincare can do. So we've got our skincare routine. Imagine we are 100% consistent.
Yes.
We're keeping it simple, and we are on board. What do we do next? I think anti-aging is a big subject, right? And people are worried about anti-aging and wrinkles even in their 20s now, right? So what is the starting point for anti-aging? First, I want to start with preventative, and then let's move on to, if I already have the lines and wrinkles, what I should
Where
do.
you're going for that. Okay, so the main reason that we age is the decrease in our collagen production.
Yes.
You know that from our 20s we are losing like 1% of our collagen.
Yes.
Per year, and at some point you get to the process of us making collagen is slower than we are breaking down the collagen.
Right.
Yes.
And that's when you really start seeing the signs of aging. So I would say that from your 20s, look at things that are stimulating your collagen production, and your elastin production within your skin. And it doesn't always mean like the most advanced injectables. You can start off by doing things like microneedling, for example. Microneedling is amazing collagen stimulating treatment.
Okay, wow, yes.
And it's one of those treatments that is almost like a cheat, because it can increase your collagen production. It can be used for scars, it can be used for stretch marks, it can be used for acne scarring, it can be used for hyperpigmentation. So if you are wanting to find a treatment, that's beyond now just your home skincare routine, microneedling is a nice thing to start with for almost everybody at any age. Even if you have an advanced skin, doing injectables and things, a few sessions of microneedling a year can really help maintain your superficial, epidermal and dermal collagen production.
And by a few sessions a year, what on average would you recommend?
Okay, so I say if you have fairly good skin and you don't have really bad acne scarring, maybe a mild bit of pigmentation, you can look at doing a microneedling session once every 8 to 10 weeks, and then
right.
that's equates to about 6 times a year.
Yeah.
If you have like concerns, like I have pitted scarring, my pigmentation is really flared up, you can almost do a short course of it, like 3 or 4 sessions,
Okay.
4 to 6 weeks apart, and then go into a maintenance session after that.
Okay.
Like everything in life, the quality of the microneedling you do is really important. And buying a microneedling device on an online store is not
what really, yes, because there's the rollers firstly,
as well,
and then the actual devices.
But
that
even
are
with devices, there's different quality devices, and you would rather get fewer sessions with a really high quality medical device than doing 10 sessions with a mediocre device. If you had to look at what the needles, the pins on a cheaper microneedling device or a over-the-counter or online store, what those needles look like, how jagged those pins are, you would never ever chance it. The higher quality devices actually use surgical steel. It's precision microneedling. The needle is cut at the same kind of quality that a surgical blade is actually manufactured.
And I'm sure because you are injuring the skin, you can have post-inflammatory hyperpigmentation from the wrong microneedling.
100%. From the wrong device, you're going to cause more problems in the long run.
And there is something about the depth of the needles as well, right?
About the depth. So depth can be varied with most microneedling devices. But speed is important. How consistent that vibration is over the period of the treatment, and what is used in the treatment. You've got now this opportunity to create these microchannels. Make sure that you're actually using it to the best of its ability in terms of producing results. But also at the other end, the skin is it's a sensitive organ, and so the way you more, deeper, harder, faster, longer is not always better. A well-titrated treatment would give you better results sometimes in going deeper and needling too soon between sessions. So I think that's one of the treatments I would look at in terms of starting your aging process. Then there are other treatments that we could do. For example, peels also can be done, superficial peels, no downtime, using ingredients such as lactic acid and mandelic acid. There's so many beautiful peel ingredients now, and combination peels that give you no downtime, but can help you towards keeping your skin renewed, increasing the cell turnover. That is all part of the anti-aging process, and also pro-aging, so aging beautifully.
Of course, that's an important point.
To be able to age is a luxury. To have longevity, had time with your family, had experiences. So as much as we all want to, we don't want to age. I think rather wanting to look the best for our age. Should be our goal.
I love that. Look the best for
so I'm really trying hard to change the mindset of anti-aging to like pro-aging, so aging positively, and embracing where you are at, and doing the most that you can or the best that you can for your skin and for your the changes that are happening in your skin, but also not becoming obsessed with it, that it takes away,
of course,
10-step routines that take our time of the day.
Exactly. No, absolutely. And I think, with that, we've got the Beverly Hills kind of look where all the stars are starting to look so similar because everybody wants to be pulled and tucked, and that is seeming to be the norm. And I think even in our communities, we see so much that features are starting to resemble each other. And I guess that's because of filler or pictures that they were aspiring to look like, right?
Completely. And I mean, I think if you have the privilege of traveling a bit and you hop onto an aeroplane now, you almost see like a carbon copy cut out of what people are looking like.
Funny.
And I think that the lips, the cheeks, the jawline, everything is augmentated. And while I mean, this is my profession. These are things that I do. It's my passion. I think we have to embrace the individuality, of our inheritance, of our cultural features, our ancestral features. And I think what looks good on a Russian face is not necessarily going to look good on a South African face. And I think that understanding that is so important, using what we have in terms of medical aesthetics and safe products and quality products, but respecting what we have from an ancestral point of view. And I mean you guys know it's a pet hate, the over augmented look. I work really, really hard, to try and create the kind of practice where we are we are helping you with these concerns, but we're still staying true to what your anatomy is,
Exactly.
what your,
Absolutely.
you know,
And I
features
see it
and
with
genes.
makeup, right? Because I do a very natural makeup, and some people don't like it because they want a completely beaten face.
Yeah.
It doesn't go with my aesthetic. So I know my clients want to have makeup that enhances their features but still makes them look natural.
Completely. And I feel like I am also in like a really special place in my career
Yes.
now. We like, you know, I know what I want to create, you know, and I feel like the type of patients I see have the similar kind of goals in terms
Yes.
of what they want. And I am comfortable saying no. I mean, I
Yes.
think you also
Absolutely.
at say, you know, this is not something
Right.
I'm comfortable with.
Yes.
I think
Yes.
that, you know, this is not going to look good on you. It's not going to, you know, transcend well over time, you know. So though, and they are, that's your professional opinion, you know,
Yes.
that's worth your, the hours you've studied, the time you put
Absolutely.
in, the experience you've
Absolutely.
actually built over the
Yes.
years. So I think, you know, finding the right sort of options for every sort of background, skin type, you know,
Totally.
facial features, you can use what we have to create that without creating carbon copies.
Absolutely. I
Yes.
love that.
So I think everybody's interested in Toxin, right? And it's one of those things that literally gives you almost instant results.
Yeah.
It's amazing. It doesn't last forever, but people have this preconceived idea that it's a frozen face. We know it's not a frozen face. What it's doing is eliminating lines and wrinkles, which we all want. So can we break down this whole stereotyped perception that everybody has about Toxin and why you would advise it? I know you would advise it. I would advise it. Resh would advise
Absolutely.
it.
But in saying that, you know, I posted a picture when I did my Botox on my forehead with you, and I had like such outroar. So many people were like, "Oh my goodness, you did Botox." I'm like, guys, everybody's doing Botox. Are we not talking about it?
No, completely. And I think that, I mean, even if everybody is not doing it, if you want
to
do
do it,
that is
okay.
the end of the
Yeah.
story.
I wish I started earlier. You know, we have got 5 hairs on my forehead.
Yeah.
So I wish I had started earlier to prevent wrinkles on my forehead.
Okay, so I have to say, I mean, I think that something that the three of us share in common is that we are very expressive. We talk with our whole faces.
Exactly.
And I think, and we all sitting here have had Toxin done. And I don't think I've ever looked at you and said that your face is frozen. And I think if people that follow me or follow us, they see. I mean, we'll be talking.
Eyebrows are
Everything is
moving,
moving, you know. And I think
Exactly.
our families would test that they know when we are angry.
Yes.
They can see that, you know.
Yes.
So I think that it's not that the issue is not the toxin. I think the issue is how much of it, how it's actually been sort of planned on your face. There is definitely a gradient between a natural looking toxin plan and a frozen look.
Yes.
Some people want the frozen look, you know, it's probably some patients it actually suits them, and it's something that's what they want, you know what I mean? So helping them navigate and achieve that is also part of my responsibility as a doctor.
Yes.
It's not for everybody, you know,
and
it's also one of the determinants is your age, the age you started, the age where you're at, you know. In a young patient, you're trying to do more preventative, you know, you're trying to keep the lines soft, you're trying to keep the crow's feet and the 11 lines from becoming sort of indented in the skin. But as you get older, I think where I am now in my 40s, I am looking for a smoother look.
Yes.
And I think that the reason why there is so much sort of drama and judgment regarding getting toxin is that because it's a toxin, you know, and people like always say, "Are you putting poison in your face?" and all of that. But you know, in the botulinum toxin that we are eventually injecting, it is a purified form of the product. There is no active, you know, toxin, you know, in terms of, you know, creating botulism in it. Basically, what the product is doing, it's the message between the nerves and the muscle that causes contraction. It's softening out that response. Okay, so yes, so you can have movement if you want. You don't actually have to have a frozen look, you know. And at the end of the day, it's your personal preference. You know, I think we are enlightened. You know, we are educated. We are, and one of the things that comes with that is choice. We have worked so hard for choice. Whatever our choice is, that is it. It is your choice. You know,
but it really does give you a smoother, softer look.
100%. And there's so many things you can actually do with your toxin. Not only just about the lines and wrinkles. If you have asymmetry in your face, you can use toxin to get better symmetry. I mean, I actually have a young patient who had a Bell's palsy. That's
Yes.
a paralysis on the face.
Yes.
And we use Toxin to help her
Wow.
symmetry, to
That
help
is
her
amazing.
relate to a world better, because
Absolutely.
she obviously has this asymmetry. And I mean, those are one of the more kind of rare cases that we see. But I mean, with Toxin, I mean, it's one of the most popular treatments in the clinic. It helps people's eyes look more sort of brighter, open, refreshed.
Yes.
And people are not coming to me to say, but I want no lines, that I want to be frozen. They're coming to say they want to look more approachable. They want to look less angry.
Yes.
They want to look less tired, you know.
Yes.
So the goal is not no lines, frozen
Yes.
faces. It is to actually look more receptive, you know.
Yes.
And when you are looking in the mirror and you feel, I am looking tired, and you feel like, for example, in terms of careers, I mean, I have a lot of my male patients saying to me the reason that they have Toxin is that they always look like they're angry and unapproachable. You know what I mean?
Yes.
So the way people perceive them changes everything for them from a business point of view, you know. So having a little bit of Toxin relaxes those anger lines in the middle of the forehead, and it changes the whole conversation almost, you know.
Yes.
You look more relaxed.
Do you get a lot more male clients now?
100%.
Wow,
I
love
love
that.
yes, that, we are more open. The conversation has been
Yes.
had. They're looking at options, and I
Yes.
think that evolving from just using basic soap in the shower to actually,
Yes.
to actually building skincare routines and to actually looking at what other options are available.
I'm
from
laughing.
an
Kevin
anti-aging
is one of those people that just use the soap. No, I love the fact that you know what in medicine we have evolved in everything. If we have latest technology when it comes to cancer, diabetes, everything, I don't know why we hesitate when it comes to your appearance and your skin. Use what has been developed. I'm all for it.
And I think the other misconception that it's cosmetic, or that it just
Fake.
beauty.
It alters the way you look.
Completely,
Yeah.
but it's not.
Yes.
How you feel about yourself is part of your
Absolutely.
mental health journey.
Oh my
How
goodness.
you actually present yourself to the world, and with aesthetics as a role to play in that. I mean, the better you feel
Absolutely.
about yourself, the better you interact with your world. And it doesn't have to be unnatural.
Because the best outfit you can wear is confidence.
Completely.
If you are confident in your skin, you literally are the best version of yourself, right?
And that's one of the things I absolutely love about my job. When you see how people's demeanor changes,
Yes.
how much straighter they sit, how much
Absolutely.
friendlier and more outgoing they are, because they
I actually
their
have
confidence
goosebumps
back.
because I know I get the same feeling with makeup.
I'm
It
sure.
makes such a big difference.
It makes a huge. I mean, that's what
Yes.
makes what we do so amazing. That you
Absolutely.
change more than the way people look. You
Yes.
change the way they feel about themselves.
Absolutely.
So another thing that a lot of people, and particularly brown people, have concerns with is their under eye. The pigmentation, the hollowness. What is the best thing we can do for that?
So I think with brown skins, the big issue is the hereditary factor. I think it is an ancestral issue almost.
Yes,
we
we all have
the
it, yes.
pigmentation, and it's related to our actual bone structure and anatomy. So sometimes even in the 20s, we have
Yes,
patients with
that's
really
true.
dark
Yes.
circles under the eye, and so for me, the way to address the dark circles is to understand that it is happening from superficial layer in your skin, so the pigmentation, the
Right.
quality of your skin, then also underneath the skin in terms of your volume there, and just the way your bone structure is. So when you're looking for a treatment to address your dark circles, I think you need to be assessed for what actually is causing your dark circles. Is it the pigmentation in your skin? Is it the fact that you have a volume loss there and the hollowness is creating that shadow effect? Is it a combination of all of that? And in that way, you can find the best treatment for you. For me, what I have found has worked amazingly for my patients, myself, and I mean, it is the PRF, the platelet-rich
So
fibrin.
Reshna, we're just saying you
Yes,
need to
that-
come for
that's
that
what
one.
we
That
want to
treatment
come
is
for.
actually, I think it really resonates with people because it's based on using your own blood and
Yes.
processing that and extracting that platelet-rich fibrin, which is a natural biostimulator. It's got all the type of ingredients our skin needs to help to regenerate, and you could use it in a multi-layered approach from the skin all the way to the layers below. So I mean, for me, that's at the moment, even though it's a trending treatment, the science is solid, the evidence is solid, and I mean, the result speaks for itself.
Absolutely.
And I think we are. I mean, there's a lot of people that are looking for more, they want to do something to help them look good, but they are looking for more natural options,
Yes.
you know.
Yes.
And this is definitely one of them, you know.
Yeah.
Yes.
PRP and PRF.
Yeah, that's
So
looks
in recent
amazing.
days, filler has gotten quite a bad rap, and people are going to dissolve their filler because it's migrated. Is filler that bad? Would you recommend filler? Can you give us a little bit insight on
Yeah.
filler in
All
general?
right, so I think that, you know, nothing in moderation is bad.
Yes.
Okay?
Right.
And
Yes.
although I'm a far more conservative injector when it comes to using fillers and the volumes that I use, I still use filler every
Yes.
single day in my practice. You know,
Right.
and
Yes.
I think that understanding how filler can work for you
Yes.
is important. So
Yes.
there's a difference between trying to restore with filler, so you know, helping you with volume loss, and then augmenting with filler,
Oh,
so
yes.
changing your features slightly.
Yes.
Yes.
And I mean, there's a balance between the two of those. You know,
Yes.
filler is not bad. It's how the filler is being used that is the issue. And I
Yes.
think previously we had such limited tools in our toolbox when it came to addressing the signs of volume loss and aging, and that we used filler to do everything.
Yes.
Yes.
And when we know better, we do better. And
Yeah,
now we know
absolutely.
better. There's better options available. All the
Yes.
biostimulators that have become available.
So biostimulators are all the trend. We have done it and we love it. I love the idea of building collagen naturally, because I feel then you also keep your facial structure, right?
Completely. And I think what we can do with biostimulators that we couldn't do with fillers is that you
Yes.
can almost follow the natural planes, contours,
Absolutely.
and you know, dimensions
Yes.
of each face, just improving the quality of the skin and the collagen volumes within
Yes.
the skin. You know,
Yes.
and I think that with fillers, what has happened over time, just to come back to that, is that, you know, filler upon filler upon filler
Yes.
has become the problem.
Yes.
Yes.
And you know, filler does have the potential to migrate, but the more filler you're using, the more it's going to migrate. If you are using fillers in conservative volumes, the right type of filler for the particular area,
Right.
and then also waiting for the filler to almost kind of
Dissolve.
and reach its natural lifespan before re-injecting
Yes.
will help you maintain the natural results.
Right. Got
And
it.
like, it's like, you know, I think the big thing is, you know, under eye filler and lip filler with the migration. That is like a lot what we've been seeing on social
Yes.
media,
Yes.
and
Yes.
people telling their stories. And those two areas are the areas where you need to be using the softest filler, the one that, you know, is able to like kind of, you know, move with your lips, for example, so that you're not
Yes.
getting the stiff look and you're not getting migration. And I think often when the look that you want to achieve is like, you know, a very augmented full look, and it was made famous, like, or famously known as the Russian lip.
Yes,
Like
that's
the
it.
Angela-
Yes, yeah, you know.
Angela-
So what you know, certain injectors use is they use a stiffer, firmer filler,
Okay.
and that has a higher chance of migrating.
Yes.
The technique of the Russian lip technique as well does predispose you to more to migration
Okay.
of filler. But the under eye area is literally volume, you know. The
Right,
bigger
yes.
volumes you put in, the skin is the thinnest there, you know, under our eye area.
Yes.
If you're using large volumes, you are eventually going to get pushed back and dispersion of that product because
Yes.
it's got nowhere to go,
Yes,
really,
yes.
you know. And so I think that when it comes to filler, if it's part of a plan with other modalities, so that you can use less filler, you know, and
Yes.
and enhance the skin and improve the quality of the skin using other modalities, then you can use less filler, and then
Yes.
you know, filler then is not bad.
Of
Yes.
course,
Yes.
yes. So we're talking about quality of skin, and we've done your skin boosters, and I feel that's one of your best treatments because it's really affordable,
Yes.
and it's dealing exactly with the surface what you're seeing. So we're not working on everything you're getting an instant glow, right?
So the first time we did it was before reunion, right?
Before reunion,
and
yeah.
we said to Dr. P, we want to look good for reunion, and you did the skin boosters, and they were amazing.
Amazing.
We
amazing.
literally had a glow.
Yeah, so I think that's the beautiful thing about skin boosters is that it's been placed in the layers of the skin that helps with, you know, refinement of the pores, and also a bit of collagen stimulation. So it improves the skin density to a certain
Yes.
degree. So you're getting great light reflection on your skin,
Yes.
and you're keeping the turgidity almost in your skin
Yes.
itself, and you're not really adding that much volume to the face. It's also done throughout the face, not
Yes.
just in isolated
Yes.
volumes, you know, within the skin. So I really do love skin boosters,
Yes.
and I think it's, from a cost point of view, 100%. It's one of the more affordable injectables to do.
Yes.
You don't have to do it very frequently, so you can budget it over the year for it, you know.
Yes.
And it's something, if you say like, okay, I have a few weeks to get my skin looking really glowy and radiant
for a wedding,
for your
daughter's wedding.
Amazing option to go with.
I absolutely loved it. Reunion.
Yeah. Okay, and then I think we've got to touch the subject because we are brown skin, and a lot of people think fair is holy grail, lighter is holy grail. What do you get that in your practice in 2025?
Arish, that is like it's a massive topic. It's something that I'm really passionate about educating and talking about, and often in having a skincare practice, and I think people come to me with these issues of obviously their complexion, their pigmentation, and all of that, right?
Yes.
But it's one thing that I really want to educate more on is that fairer does not equate more beautiful.
100%. I totally agree.
Whatever shade we are.
Yes.
And as brown skin people, we have the most stunning features.
Totally.
And moving away from seeking our affirmation in terms of what our complexion is looking like. I mean, we have to move beyond that,
because even skin tone is where it's at, not a fair skin tone, right?
Yes. And I'm treating pigmentation is my specialty. I'm passionate about it. I'm good at it. It's, we've developed a reputation for being a depigmentation and an expert in treating it.
Yes.
But that's what I do, and I do not do whitening and lightening treatments.
Yes.
There is no way to change your natural skin tone without damaging your skin.
Yes.
Our melanin is our protection.
Yes.
It is part of the reason why we have such low risk of skin cancers in our communities. The melanin in our skin, is actually what also gives us our beauty. I mean, that's like it's one of the world that is trending in terms of looking more tan, looking more bronze,
and fake tans to get the skin tone.
And we in our community are trying to, get rid of that.
I think it's got a lot to do with apartheid, and in India the British rule where white people were seen as superior, and then it inculcated in brown people all over the world that fair is better. But I think with societal Bollywood movies, Hollywood movies, I think brown and more darker skin tones is also now beautiful. So I love the fact that we are slowly evolving. I'm just sad for some people that they still stuck on lighter is better.
Completely. And I'm sure you all have stories in your family of like, within your families of, one aunt saying, oh no, she's beautiful, but shame. I've heard, I hear women come to me in their 40s and 50s and say that, I was slightly darker than my sister, and I was always made to feel inferior because of that.
Listen,
and it's like,
it starts at the babies, and like everybody's waiting to see what color your baby comes out. That's literally where
my husband is really dark, right? And when we got married, people were like, Resh is so beautiful, but I'm saying, because people were so mean. And then when I had my kids, both my kids were in winter, and they had caps on, and people literally came to see what color my children would be. And my children have no idea what color, because they don't think any different shade is good or bad, because we are multicolored families.
We evolved, we are accepting, we are tolerant, we are, and it doesn't matter anymore.
Yeah,
it doesn't matter anymore,
But some children, I know one of my friend's daughters in school, the kids are calling her dark in 2025, and I'm like, what do you mean? And she says no, and the child is really hurt by it, and it's so sad.
No, it is, because especially at young teenage age, you are so vulnerable.
Yes,
you know what I mean? The way you look is at that stage when you're trying to find your identity, the way you look is attached to your identity. You know what I mean? Like, you like your self-confidence and the way you're projecting.
100%.
So if someone is making comments like that, it is going to be hurtful.
And she's beautiful, like as I'm saying, my husband doesn't need skincare because he's got such beautiful skin. I joked him because I say black don't crack. But he's so lucky. He doesn't have any pigmentation issues, so he's got really beautiful skin.
So and I feel for me like what I see happening, and no less than I did when I started practicing all those years ago. The amount of people that are using bleaching and whitening agent that are damaging their skin, damaging their barriers, causing post-inflammatory hyperpigmentation,
and irreversible, right?
Irreversible,
Yes.
irreversible.
Yeah.
So like, I mean, sometimes my only contribution can be to restore their barrier
Yes.
and prevent it from getting darker, because they've used such damaging agents on their skin.
Yes.
And it's so funny. We will take the time to buy the best quality clothes, sneakers,
Yes.
and whatever, like
Yes.
sort of material, non-medical things. But when it
Absolutely.
comes to our bodies and
We
our
buy from the
faces,
spice
we
shop.
make such ridiculous
Yeah.
choices,
Yeah.
And the worst thing that I hear is, like my aunt or my cousin was using this, so I use.
No, that's how it goes.
And it's like, and there used to be a joke about it, like people using each other's hypertension medicines and diabetic
Yes.
but it's across the board
It's
in
across the board,
medication.
yes.
And I think the thing, your skin is part of your body. It's an
Absolutely,
organ.
it's an
It's
organ.
and like you should seek professional help for any other thing going wrong in your body.
Yes.
If you have something to address,
Yes.
seek professional help from that.
Absolutely.
And I think these formulations that are available, in sort of non-skin care settings and like spice shops, and
Yes.
and are imported illegally and are available, on TikTok from someone that has
Yeah.
no
That is
actual,
a new trend now,
yes,
right?
a skin background or
Yes.
medical background. The damage caused by those products are just, it's more than just you might get pigmentation.
Yes.
You can damage your skin
Mhm.
irreversibly, predispose yourself to a
Mm.
whole lot of other skin problems that that will become difficult to treat going forward.
Absolutely.
Yes.
Yeah. So I think my motto is, as a practice and a clinician, is like helping people feel comfortable in their own skins.
Yes.
And it's more than just like helping you with your journey of aging or acne. It's like where you are at, to help you feel the best you can, where you are at with what you've been
Absolutely.
given, and like whatever shade you are,
Yes.
like helping people fall in love with that or love that
I
or
love
accept that.
Exactly. Yes. So if I had a budget and I had to choose the best way and the best bang for my budget, should I invest in skincare or should I invest in treatments?
Okay, so Nosh, the marriage of those two, skincare and treatments, is what's gonna give you your best results.
Of course.
But we all have to do what we can do,
Yes.
and I think that even if you don't have a massive budget, there must be ways that you can still give yourself the best, give yourself some TLC, some self-love, and look after your skin.
Yes.
Right? And so then I would have to say, put your money in the best skincare that you can afford at home. Because honestly, what you do every single day
It matters
can
more
make,
than the...
yes,
Mhm.
it can make a huge difference. And like I said earlier on when we started, go and spend that time to find the best sunscreen for yourself.
Yes.
Go and get samples, go and test a few things, find out what works for you on an everyday basis. And I think that's what skincare in general, if you're going to have to make choices, do what you do at
Yes.
home every day
Yes.
is really going to make the
A
biggest
big
difference
Yes.
if you can't afford to do the treatments as well.
And for people that don't know, I love the fact that you have such a wide stock of products available in your rooms and it's at different budget points.
Yes.
So you're going to
Completely.
get medical grade skincare at every budget, right?
At every single level,
Absolutely.
and I think that is a misconception,
Yes,
that,
Yes.
oh,
The
it's
minute you
only
can have
like-
6,000,
Yeah.
7,000 rand,
completely,
8
and I get these products across the board,
Yes.
suitable for every budget, and I
Yes.
think that, also just like, I think being someone that's on social media and
Yes.
people automatically feel that when you have a certain following or presence, it's only for the select few to
Yes.
benefit from.
Yes.
But
That's
we
nice.
really strive to on our shelves whole products that can cater for every single budget.
Yes,
So,
and I must attest to that. So if you come in and treat yourself to a consult and getting your products here, it's going to be the same amount that you're actually going to end up spending at a Clicks and a Discount that you literally are going and spending 1,000 rand every time you go in, right?
Yes.
completely, and like you might land up buying products that actually don't work for you.
Yes,
And at
yeah.
the end of the day, like you
Absolutely.
actually land up, okay.
Yes.
And then you also don't stick to it because it might not have been the right thing for you. You know, so
Yes.
after a few
Yes.
weeks, okay, it's doing nothing, so you go and get a whole new lot of products. That
Absolutely. And again, I said to it, like you can go and buy a foundation at MAC, Fenty, wherever. But if you are shade matched incorrectly, you wasted that whole bottle of foundation.
No,
You would
completely.
rather come for a consult, get shade matched, and then you set to go after that.
And then you think about it also, Resh, when you get that right, everything else becomes so much
Absolutely.
simpler. You know what I mean? Because
Yes.
you've got the foundation correct,
Exactly.
And I
Yes.
think the same thing with skincare.
Yes.
If you get that foundation right, everything else becomes simpler.
Yes.
Also, you'll end up spending probably, and I'm taking a guess at it now because this is not my forte. But like, for example, now your the other parts of your makeup, like your concealers and your the type of layering you do becomes almost simpler if the foundation is better.
100%. That's the bottom line. Yeah. And I think in saying that, you know what, there are a lot of drugstore products that are good, but I still always read labels. I would still say, like, there's beautiful foundations in drugstore, for example, but I'm saying if you have really dry skin and you go with something that is mattifying, you're gonna look so cakey. So if you still, without the education and the consult, you're going to still make an incorrect choice.
Completely, yeah. And I think, that is the challenge also for me, trying to, find the sweet spot between the products that are effective and work, and then also budgets,
Yes.
But it can be done.
It can be done.
And it's done on a daily basis,
Yes.
And I think that there's just getting the proper advice sometimes.
Yes. That's all you need.
Yes.
Exactly.
Yeah.
I love that.
So I think most importantly, and what everybody wants to know, if I come in for a treatment and I get the works, are you telling my husband?
Let me tell you, if you work on social media, we would never tell them. Let them be aged gracefully.
But I what you do here. It's completely private. I mean, you can't even phone me and ask me what Resh has had on a day. But number one,
do you get that often? I'm just making it as a joke, but do you get that often?
We see a lot of couples, we see a lot of families, and but it's a medical practice. Doctor and patient confidentiality is it's
key.
Everything.
Yes.
And I mean, I probably see people at their most vulnerable. The conversations they have with me is sometimes the only other person they've had that with is themselves in the mirror. I have a deep respect for that. So whatever is we discuss, whatever you do, it is confidential. And at this and as much as I am trying to break the barriers of the stigma and talking about our journeys with everything in life, just taking the taboo away from things.
Absolutely.
Fundamentally, your privacy and what you do is the priority.
Yeah,
absolutely.
And your need to share it or not is your choice
completely.
Yeah.
And I think some being on social media, in terms of the practice, we only share what we are given permission to share.
Of course.
And I have to say, if I could really share all that we have done, the amazing transformations.
Because more people want you not to share, right?
Yes.
In all honesty, it seems to be that way in every aspect of life. Because I even know with Daika struggles, mental health, anytime you're struggling or anytime you are doing something,
that's
people
not fitting
feel
society.
like, let me hide this away.
Completely.
And if you can just be a little more open, it's also cool, right? Because I'd love to know what you did that made you look beautiful and confident, so I can do the same.
No, 100%. And I think you girls have been amazing in that. I think you've really changed almost the setting and the scene in our small Durban.
Yes,
in terms of sharing your journeys, being honest about what you're going through. Still seeking to be the best version of yourself, but not in any way hiding how hard it is.
Of course.
How hard everything is.
Everything is hard.
And I think you guys have been instrumental. So hats off to you.
Thank you.
I am super proud of our association because I think you've worked hard to build your brands individually, to be authentic in what you do, to and just to show how hard it is to juggle it all. It always looks like if you take a snapshot of any one of you, you guys look amazing. You put together, but
But
life
behind the
is
scenes, it's not always that.
And this is the thing, you've not kept it behind the scenes.
Yes,
You've made it. You've given us a peek into what it takes to actually live a fulfilling life, to strive to be there for your family, to work on your careers, to be supportive to husbands, to family. I mean, it's not easy at all,
not
and
easy
it's really hard to make yourself that vulnerable. To say this is all of me with all the all the bits and the nice bits and the not so nice bits. So really well done on that. I think we have to really say as a community, thank you for just broaching, making it okay to broach certain subjects. There's so many of them.
There's so many of them.
This what we're having today.
Absolutely.
We would never have been able to do this at the level that we've done it today, so openly.
Absolutely.
And 5-6 years ago, I mean, we've been ostracized for talking about the fact that we put needles near our faces.
Yes. So I think like moving forward, that's what we want. We want to say we want everybody to be their most beautiful, but life isn't always beautiful. But if you are feeling beautiful living this life of ours, we're doing something right.
No, 100%. And I think that the reality is the way you look is a part of your armor. It's what gives you that confidence to tackle that not so nice bits.
I had teenage acne, so I was on the pill from 19, Diane at the time, so with the weight gain and the lot. And then I went off the pill because I wanted to fall pregnant. I was married for about 2 years, and Losh was getting married. My skin, Parush, was horrific. I was so embarrassed. I didn't want to leave the house. We had all of the stuff at the wedding and coming through, and every auntie was like, why your skin so bad? You must do this. One of my aunties told me that I must put pee on my pimples. Like crazy things. And I just remember, I wish people didn't comment about it. I wish people would have rather not said anything.
And this is something that is so important. I mean, when you wake up in the morning, how many people are not looking in the mirror? How many people are actually, everybody's aware of the pigmentation we have. You actually don't need someone else to point it out. You literally don't need that, And I think as much as yes, people want to be helpful and help, you can be helpful and be there without actually making someone feel worse about whatever it is. Their acne, their pigmentation, even if the foundation is not matching properly. Sometimes it's just, it's trying to keep quiet and not say anything. If someone asks you for advice,
that's
go
a different
ahead, give it. Give the best possible advice you can. But unsolicited advice can be so damaging to people's morale.
But not looking your best is so bad for your mental health where you really don't want to leave the house. I know exactly how it feels. So this is what we want, for women to feel beautiful in their skin, and so they're better for their families and their lives and their careers and everything.
No, I mean, that is the goal.
That is the goal.
Feel and look the best that they possibly can, so they can live their best possible lives.
And that brings us to the end of this podcast. We've discussed such a lot, but luckily for all of you, we are all on social media. So if you want any information, you can message us. But I really do think a visit to Dr. P is going to make the biggest change in your skincare game. So let's all prioritize our skincare.
Absolutely. And yes, you're looking and feeling beautiful. Thank you, Parush, so much for enlightening us, for being honest about the journey. We are so looking forward to always being with you. And we thank you again for just educating the public and our fellow brown girls.
Oh, thank you so much. It was amazing speaking about what I'm so passionate about, and just actually spending time with you girls and chatting. We actually don't get to do that often.
We don't, right?
It was amazing. Thank you so much.
Thank you. And we'll see you on the next episode.